hello. So today is Saturday, May 30. It's my lovely sister's birthday.
Happy
Yay!
birthday!
Happy birthday. Happy birthday. So it's time for my COVID-19 update. As you can see, I'm not doing always my COVID-19 update because I'm a little bit busy. I joined as a volunteer in Ministry of Public Health as a field team, swabbing team. So that's why. Swabbing means we are the one taking samples from the people in contact with the positive patient. What we are doing, it's made of cotton. We put it inside your oral thrush and inside your nasal thrush to get some samples, mucus samples, and then send it to the lab to clarify if you are negative or positive. That is what we call swabbing team. And I will share you also some of our videos during our donning and doffing of our PPEs. So let's go for our Qatar COVID-19 update. New cases 2,355. It jumps up. And with the total now of 55,262 coronavirus cases here in Qatar, active cases is 29,387. We have recovered 5,235, which is good. With the total now of 25,839 recovered cases. 0 deaths today. So we have total deaths of 36. People tested within 24 hours is 5,091. This is what we are doing. We're going on the field, swab those in contact with the positive patient, and then send it to the lab. That's why with the total now of 5,091 within 24 hours only. So total of people tested now here in Qatar is 217,988. So about Ithera's app is now compulsory here in Qatar. If you don't have that in your phone, if you did not download that app yet, you will have fine $55,000 or 3 years in jail. So please download it now before it's too late. PHCC opens 3 drive-through swabbing hubs for COVID-19. As part of the country's wide efforts to manage the COVID-19 outbreak, PHCC will be operating 3 drive-through swabbing hubs at 3 PHCC health centers. Beginning on Sunday, May 31, Al Waab, Alto Mama, and Baib Health Centers will operate COVID-19 drive-through swabbing hubs. Each health center will be operating the drive-through testing between the hours of 2 p.m. and 10 p.m. initially, with a view to extend hours at a later date, should this be necessary. Increasing testing capacity within the community also builds data that will capture virus rates, allowing for further enhancement in the response to COVID-19. So here's another thing. Working hours for commercial activities from 7 a.m. to 1 p.m. from Sunday. So tomorrow, the Ministry of Commerce and Industry said yesterday in a circular that work hours for commercial and service activities in Qatar will be from 7 a.m. to 1 p.m. from Sunday. The steps are taken within the framework of the preventive and precautionary measures taken in Qatar to contain the COVID-19 outbreak and in the line with previous decisions and procedures. Now it's time for my Worldometer update. So here's my Worldometer update. Coronavirus cases is 6,067,531. Deaths, 367,595. Recovered, 2,688,279. Active cases, 3,011,657. Serious or critical is 53,563, which is 2%. Mild condition is 2,958,094, which is 98%. Total cases, USA 1,797,044, Brazil 468,338, Russia 396,575, Spain 285,644, UK 271,222, Italy 232,248, France 186,835, Germany 183,118, India 176,370, Turkey 162,120. New cases, Russia 8,952, USA 3,514, Mexico 3,227, India 2,879, Pakistan 2,429, Qatar 2,355, Iran 2,282, Bangladesh 1,764, Saudi Arabia 1,618, Kuwait 1,008. Total deaths, USA 104,633, UK 38,161, Italy 33,229, France 28,714, Brazil 27,944, Spain 27,121, Belgium 9,453, Mexico 9,415, Germany 8,598, Iran 7,734. New deaths, Mexico 371, Russia 181, USA 91, Pakistan 78, Iran 57, Indonesia 53, Sweden 45, India 44, Bangladesh 28, Belgium 23, Saudi Arabia 22. So that's all for my Worldometer update. So the cases is still increasing. Please be safe, stay at home, just go out if necessary, and always wear mask. Maintain social distancing at least 2 meters away. Avoid touching your face, especially your mouth, nose, and eyes. And also have enough sleep at least 7 to 8 hours, exercise, eat nutritious food, and avoid smoking and drinking. This will help to boost our immune system. So before I will end my video, I will share some video clips of Hamad Medical Corporation about HMC announces new protocol for handling of COVID-19 patients. Please watch this.
Oh, hello, ladies and gentlemen. I'd like to update you about the latest as regards to delivering care to patients infected with COVID-19, coronavirus. As you know, the care that we provide is very much influenced by the latest scientific evidence and the protocols and guidelines issued by very well-known and accredited organizations such as the WHO, the CDC, Center for Disease Control, and other European organizations. Now, the new development is that basically when patients are admitted in the hospital because they're confirmed to be infected with COVID-19, rather than waiting for more than 2 weeks and doing 2 tests 24 hours apart to confirm that the patient is negative for this virus and then to be discharged, this has changed. We don't need that anymore. Why? Because the evidence has shown that when patients are initially infected with the virus, and provided that if you will, the course of the virus is the usual, there is no complication, and I'm going to come to that in a while, that following 14 days from the time the virus was confirmed, the patient is deemed as non-infectious. Now, this area is a bit tricky because in the past, even though the patients are not infectious, when we do the test, as we call it, the PCR test, it was in many occasions positive. But positive means that the virus is there in very small trace amounts and is not deemed to be of infectious danger or nature to other individuals. Hence, we have changed our practice now, and every patient, or the majority of patients who are admitted, confirmed to have COVID-19, following 14 days, they can be discharged. The advantage, as you well know, that they will leave earlier, they will leave hospital. It's nice to be out of the hospital, and they will join their loved ones, their families. Now, the other thing is there's always an exception to the rule, as you know, and there are situations where if the patient, God forbid, has got a complication as a result of this viral infection, such as pneumonia, a condition we call ARDS, another medical condition, then they will be assessed individually, and on the basis of the judgment of the doctor looking after medical staff, then and further testing, which is virological testing, then a decision will be made as to what is the most optimal time for them to be discharged. Another dimension I wish to mention is that there are individuals within the household where the patients are going to join following their discharge, where they are particularly vulnerable to such infection, and indeed other infections, such as older people, people who have chronic diseases, people who are immunocompromised. All those are given due consideration. So what happens is the patient is not discharged automatically after 14 days, but rather 2 further samples are taken 24 hours apart, just to make sure absolutely the virus is not there. Now, if it is not there, then they still will go home. But if it is there, then as a precautionary measure, patients then need to stay for another week. And following that, automatically, without any further tests, then they are discharged home. I could not emphasize more, please, on your compliance with basic infection prevention and control measures, and very important to observe distancing. Thank you very much.